Joining us is Executive Director at Migration Watch, Mike Jones. Mike, a lot of people at home will be quite angry seeing this.
Yes, this is a particularly shocking case, and hats off to the Daily Express for lifting the lid on this scandal. But is it surprising? No. Illegal immigrants who apply for asylum are entitled to all sorts of freebies. You know, free accommodation, free prescriptions, free dental care, free eyesight tests, transport subsidies, taxpayer subsidised vouchers for glasses, maternity payments, cash support, and of course, free healthcare. Now, what's happening here is that the NHS are awarding GPs contracts to turn hotel rooms into makeshift surgeries so that illegal immigrants can receive the care they need. Basically, the social contract is broken. The purpose of the NHS is to provide healthcare to British people. It's not just a form of socialised medicine, it's a system of universal healthcare designed for British people. And what really sticks to the craw here is that British taxpayers are already waiting weeks for GP appointments and, you know, sometimes close to 2 years for medical procedures. So there's a crisis in both primary and secondary healthcare, and this is making it much worse.
Mike, in one of these NHS trust areas, the elderly are having to wait up to a month for a GP appointment. Why is it that they get to actually skip the queue rather than just join the queue like everybody else in the local area? Why do they get preference over those who have paid into the system through their taxes but aren't getting the service?
Yeah, it's a topsy-turvy system, but illegal immigrants who apply for asylum are given priority for humanitarian reasons. It doesn't matter if they've destroyed their documents, if they failed to claim asylum in a safe country. It doesn't matter that they've paid, you know, sums of cash to criminal gangs. The fact is the political class will prioritise these people for so-called humanitarian reasons. And it's perverse because you've got to remember the NHS is under immense strain. You know, we've got very long waiting lists for orthopedic surgery, you know, hip replacements, ophthalmology, you know, cataract procedures, macular degeneration, general surgery, gynecology, ENT, neurology, the list goes on. And the British state is prioritising non-citizens, lawbreakers ahead of their own people.
Mike, I thought this government was meant to be ending migrant hotels anyway. What's happened with that? I mean, they've been popping up all over the country since Labour took power.
Yeah, the number of migrant hotels has actually increased, although, you know, Labour hasn't been in office for very long. I mean, the Labour Party may actually meet that target, but you've got to remember that doesn't eliminate the costs. It merely shifts them elsewhere into the private rental sector. And you've got to remember the Labour Party have also fast-tracked a lot of these applications through the asylum system. Most of these people, I imagine, will be given leave to remain.
Yeah.
And of course, these people are going to be a burden on the taxpayer and on public services in the long term.
OK, Mike, thank you very much. Mike Jones, Director at Migration Watch, thanks for joining us this morning.
Goodness me, I think you'd be better off sending Granny to France and getting her to come back in a boat so that she can get an appointment quicker than within the month.